Imagine stepping into a hospital in 2040. There are no crowded waiting rooms, no clipboards, and no long waits for test results. Instead, your health is managed seamlessly by an intelligent system that knows you better than you know yourself. This isn't science fiction. It's the future of healthcare, and it's being built today with artificial intelligence. Stick around as we pull back the curtain on the incredible medical revolution that will transform all of our lives by 2040. So, what does this AI-powered future actually look like? Let's start the moment you feel unwell. Instead of frantically Googling your symptoms, you'll talk to a sophisticated AI-powered virtual health assistant right from your home. This isn't just a simple chatbot. It will analyze your voice for subtle signs of illness, use your smartwatch data to check your vitals in real time, and access your lifelong health record to understand your personal risk factors. Based on this comprehensive analysis, it can provide an initial diagnosis with remarkable accuracy, recommend immediate care steps, or even schedule a virtual consultation with the right specialist, all within minutes. This immediate, personalized triage will dramatically reduce the burden on emergency rooms, saving them for true emergencies and getting you the right care faster. Now, let's talk about the powerhouse of this new era, predictive medicine. Today, we often treat diseases after they've already taken hold. By 2040, the focus will shift almost entirely to prevention, thanks to AI's ability to analyze massive datasets. AI algorithms will continuously sift through your genetic information, lifestyle data from wearables, and environmental factors to predict your risk of developing specific conditions like heart disease, diabetes, or even certain cancers, years before any symptoms appear. Imagine getting a notification on your phone. Your data suggests a 70% increased risk of developing type 2 diabetes in the next 5 years. Here is a personalized nutrition and exercise plan to lower that risk. This isn't about scaring you. It's about empowering you. This predictive power gives you and your doctor a crucial head start, turning healthcare from a reactive system into a proactive partnership for long-term wellness. You're no longer just a patient, you're the CEO of your own health. Diagnosis is another area where AI is set to become superhuman. For doctors, interpreting medical images like XORS, CT scans, and MRS is a high-stakes task where experience is key, but even the best human eye can miss subtle clues. By 2040, AI will be an indispensable partner for every radiologist and pathologist. These AI systems, trained on millions of annotated medical images, can spot abnormalities with a level of precision and speed that far surpasses human capabilities. They can highlight suspicious nodules on a lung scan that are practically invisible to the naked eye, or identify cancerous cells in a biopsy slide in seconds, instead of days. This won't replace doctors. Instead, it will augment their skills, acting as a tireless, incredibly precise second opinion. It frees up doctors from tedious, repetitive tasks to focus on what they do best: complex decision-making, treatment planning, and providing compassionate patient care. The result? Earlier, more accurate diagnoses for everyone, leading to better treatment outcomes and saving countless lives. Once a diagnosis is made, what about treatment? This is where hyper-personalization comes in. The one-size-fits-all approach to medicine will be a relic of the past. By 2040, AI will design treatment plans that are tailored specifically to your unique genetic makeup, lifestyle, and the specific molecular signature of your illness. This is the core of precision medicine. For a cancer patient, for example, AI will analyze the tumor's genetic mutations and recommend the exact combination of therapies most likely to be effective while minimizing side effects. It can simulate how different drugs will interact with your body before you ever take a single pill. This level of customization means more effective treatments, fewer adverse reactions, and a faster path to recovery. We're moving away from trial and error and toward targeted, intelligent therapeutic strategies. But what about the surgeons? Will robots take over the operating room? Not entirely, but they will certainly transform it. By 2040, AI-guided robotic surgery will be the standard for many procedures. These robots, controlled by human surgeons, offer unparalleled precision. They can make incisions smaller than a human hand ever could, navigate delicate tissues without causing damage, and eliminate natural hand tremors. AI will provide surgeons with real-time augmented reality overlays during an operation, highlighting critical nerves and blood vessels to avoid. It can analyze data from thousands of previous surgeries to guide the surgeon's movements and suggest the most effective techniques in real time. This leads to less invasive procedures, reduced blood loss, less pain for the patient, and dramatically faster recovery times. You could have a complex surgery in the morning and be recovering comfortably at home by evening. The revolution doesn't stop at the hospital doors. Managing chronic conditions like diabetes or hypertension requires constant monitoring, which can be exhausting for patients. By 2040, AI-powered systems will make this effortless. Smart implants and non-invasive sensors will continuously monitor your body's key metrics. This data will stream to an AI platform that can detect problems before you even feel them. If your blood sugar is trending upwards, the AI can automatically adjust your insulin pump. If your blood pressure is rising, it can alert you and your doctor and suggest immediate actions, like a short walk or a breathing exercise. This creates a continuous closed-loop system of care that keeps you stable and healthy, reducing the risk of complications and giving you the freedom to live your life without constant worry. It's like having a dedicated medical expert watching over you 24/7. One of the most exciting frontiers is drug discovery. Developing a new medicine today takes over a decade and can cost billions of dollars, with a high failure rate. AI is set to supercharge this entire process. By 2040, AI algorithms will be able to analyze vast biological and chemical databases to identify promising drug candidates in a matter of days, not years. They can simulate how potential molecules will interact with proteins in the body to predict their effectiveness and potential side effects, drastically reducing the need for lengthy and expensive lab experiments. AI can also help design clinical trials more efficiently, identifying the perfect patient candidates and predicting trial outcomes. This acceleration means that cures and treatments for diseases that are currently considered untreatable, like Alzheimer's or certain rare genetic disorders, could be within our grasp much sooner. Of course, this technological utopia raises important questions. What about data privacy and security? Who is liable when an AI makes a mistake? And how do we ensure this technology doesn't widen the gap between the rich and the poor? These are critical ethical and logistical challenges that we must address. By 2040, we will expect to see robust regulations, like a digital Hippocratic oath for AI, ensuring that patient data is anonymized and securely protected. Clear legal frameworks will need to be established to define responsibility. Most importantly, we must focus on making these AI tools accessible and affordable for everyone, everywhere. The goal of this revolution isn't just better healthcare for some. It's to democratize medical expertise and create a higher standard of care for all of humanity. So, the year is 2040. Healthcare is no longer a place you go when you're sick. It's a constant, invisible partner in your life, dedicated to keeping you healthy. It's predictive, personalized, and participatory. From AI assistants in our homes to robotic surgeons in our hospitals, technology will empower both patients and doctors in ways we are just beginning to imagine. The future of medicine isn't about replacing the human touch. It's about amplifying it, freeing doctors to be more empathetic, and giving all of us the tools to live longer, healthier, and fuller lives. Thank you so much for joining us on this journey into the future. What part of this AI health revolution are you most excited about? Let me know in the comments below. And if you enjoyed this video, please give it a thumbs up and subscribe to the channel for more glimpses into the world of tomorrow. Stay curious.